I discovered I had type 1 diabetes after several tests were run on me, but nothing was found. And then I was referred to the Tema General Hospital. That was where I was diagnosed.
It was discovered in 1999 when I was in the primary school. My mom took me to Mana Mission Hospital. I was there diagnosed that I have type 1 diabetes.
Diabetes is an endocrine problem. When we say endocrine disorder, what we mean is that the way some hormones affect the body. So in diabetes, what happens is that there's a particular hormone that is affected. It's called insulin. The insulin is a hormone that is secreted by a part of the body which is called the pancreas. And the pancreas sits right behind your stomach. So the cells that produce that insulin are called beta cells. So in diabetes, it's either the cells are not able to produce the insulin, which is the hormone, or it's producing but it's not working properly, or both of these things are occurring at the same time.
Diabetes is a group of disorders which are characterized by certain things. One particular one is persistently elevated blood sugar levels.
I'll explain it like this. When you have taken a meal that usually will contain some carbohydrates, your body will break it down through digestion. The end product of that is called glucose. That glucose is the main form of energy for the body. So the body cells should be able to use that glucose to, for their basal metabolism or whatever they need it to do. So when that glucose is in the blood, once it goes high, the insulin will come and then direct the glucose into the cells. So the insulin will serve, for example, as a key. So assuming the cells, the doors are closed, insulin will come and fit into the keyholes and open the doors and allow the glucose to move from the blood into the cells. This is when the cells are able to have access to the glucose, which is the main form of energy to use. So unfortunately, if the insulin is not present or it's not working properly, then it's not able to move the glucose from the blood to the cells. So your cells are actually starving, they don't have enough energy, but then the glucose is also sitting in the blood, which becomes kind of a poison to the blood because your blood doesn't like to see those high sugars. So when it stays there and becomes a poison, then it starts destroying your lining of the blood cells small, and in doing that, it will cause problems, in the future.
There are different ways of classifying them. So we would talk about type 1 diabetes. Type 1 diabetes is the less common form of diabetes. So it's characterized by what we call autoimmunity. So in type 1 diabetes, you have a complete and an absolute destruction of the beta cells of the pancreas because the source, the factory where the body produces insulin from is completely destroyed, and it is destroyed by an autoimmune process, which means the body itself destroys that part of the body. If you ask specifically exactly what is it that causes this autoimmune destruction of the beta cells so that somebody gets type 1 diabetes, we are not sure. There are all sorts of, speculations and projections. Some point to an infectious agent, Coxsackie virus.
Then age. So commonly you have it occurring in younger people than older people, but it doesn't mean that age in itself is a risk factor. Then your environmental factors. So things like some infections, like especially some viral infections. These are not direct causes. But then when you get these infections, they can trigger the immune system to be defective such that it can predispose you to getting type 1 diabetes.
Type 1 diabetes is not acquired. Commonly, you will find it in children and adolescents.
Usually between 4 and 7 and another age peak between 10 and 14.
But that doesn't mean that it can't happen in adults. So long as there's autoimmune distraction, then we go for type 1 diabetes.
Symptoms of type 1 diabetes will be symptoms for all types of diabetes.
So initially, before you get clinical symptoms, you may pick up some genetic markers, you may pick up certain abnormalities in the blood. By the time it becomes symptomatic, now you will have signs to suggest hyperglycemia. So you'll have increased frequency of urination, especially at night, and that is one thing that parents need to know. It's not every child that is wee-weeing in bed that it's just any races, but you need to make sure that that child does not have type 1 diabetes because it is known to present that way. You'll have increased thirst, you'll have unintentional weight loss, you also have polyphagia, so the person is eating quite a lot of food and yet they are losing weight. And those are some of the symptoms of type 1 diabetes.
I was at age 12 when I was diagnosed. Yeah, and then it has been with me for the past 22 years.
At the age of 5, I've had diabetes for 27 years.
The news of my diagnosis of type 1 diabetes was very tough for me because I didn't know people of my age could also have diabetes. I only knew about the elderly having diabetes, so it wasn't easy for me at all.
Initially, when I was told, it was very bad to me because I didn't understand the whole thing myself.
The things I had to do to come to terms with my condition was that I decided to think ahead. And for me, thinking ahead was not letting the diabetes get in the way of my life. I had to attend the clinic more often, and there I met people of my age who have been also diagnosed with type 1 diabetes. And that really helped me because I saw that I wasn't weird, I wasn't strange anymore. I met people who were doing the same things I was doing, like checking their blood sugars and all that.
Living with diabetes is not an easy task, but if you understand it, you are good to go.
Type 1 diabetes has been fun, it has been tough. It has been everything. Sometimes I tell people it's like education. You never complete it. You still keep on learning.
What I do to help my ward manage her condition is that I spoke to my uncle's wife, who is a medical officer in the army. So she supplies her with the insulin injections, and I also made her join the Diabetes Juvenile Society, where she received assistance.
I'm learning everything about it. So I've now become the teacher. I coach him the time to take his insulin, his time of eating. I virtually do everything myself because he's so little.
Diabetes educator is someone who has gone through a specialized training to assist people who are living with diabetes and their carers to help them manage diabetes through their everyday life. Type 1 diabetes awareness is very important. They are usually younger ones, and so they are vulnerable and they will need dependence. It is quite technical because you need to test their blood sugars constantly, and they have to have injections throughout their life. And so even though there are not many, the management is quite challenging and you need a lot more resources. I have a paid service, and aside the work, I do have a support group for young adults with type 1 diabetes. And they're called Juvenile Diabetes Support Group. People living with type 1 diabetes are just like any other normal children. But usually they are younger ones, so they may be in school. So it doesn't have to stop them from going to school. However, it is not managed well, then their school activities will be interrupted very often. So I think that the fact that someone has diabetes should not stop any school from admitting that person or refusing to let them participate in any other sports or school activity. Generally, they should be treated. What the school have to do is to ask parents and doctors to give them a care plan, and they need extra training to help them manage that child, then they will ask for it. Because it is the management that would interfere with the activity. So if they have proper management plan, then that child is ready to go. Workplace, it depends on the work. Again, once the diabetes is being manageable, it shouldn't stop anybody, or it should not be a hindrance for employing someone who lives with diabetes. The church, many of us go to the church, and without God we can't do anything. But I also believe that to even find out that you have diabetes, it's a blessing by itself, because like children, they don't complain very much, and if you are not observant, in fact, diagnosis can be missed for a type 1, and within 2-3 days, between malaria and typhoid fever, if you miss type 1 diabetes, that child can die. So if you are a parent and you're lucky for the doctor to diagnose your child that you have the child has type 1 diabetes, that's a blessing by itself. What we have to do is to know how it happened and then manage it. So if I have a problem, there are a few instances where pastors and church members have said that this is a way a child can have diabetes. Somebody has bewitched you or cursed you or something. Stop all your medication. Please don't do that. It is because the body cannot make the insulin that is required in every human being. So I will plead that if the pastors or the church members have the church members' goodness at heart, then they should pray with them so that they will continue to get braveness to inject themselves for the rest of their lives, because that is what they need to do. The diabetes cannot go away unless they get a new pancreas. So if you don't have a new pancreas, it means the old one is not going to work, and you will have to inject the rest of their life. And so please, they should not let them stop their medication at all. Our society, we look after each other. Now sometimes they have good intentions. So what we have to do with our neighbors is, whoever has had the education about how type 1 is or how diabetes is should share the importance of whatever their concerns are. Sometimes people will give you, they have all these intentions, but they don't know what they don't know. So if you have the good information, you share with them and alleviate their fears, and so they can do the support that you need from them.
I want the general public to know that type 1 diabetes, it is very, very treatable. Sometimes you have people telling you, leave your orthodox medication and then go do the herbal. And at the end of the day, you see people losing their lives. I'll tell them that managing diabetes with this orthodox medicine can help you also live longer lives and healthy lives.
Having diabetes is not a bad thing, but rather they are to help us. Because the moment you stigmatize the person, you ruin the person.
My diet generally consists of any food any other person eats. I only know the portions I'm supposed to take. So I know the portion of carbohydrate to take, I know the portion of vegetables to take, and I know the portion of protein I have to take to balance my sugar level against my insulin.
I don't consider my diet as being restrictive at all.
I do take everything except sugar. And even with the sugar, when you fall on hypo, that is what we take. So we take everything.
Type 1 diabetes is one of the neglected types of diabetes. It happens in the young, usually, and so it's a cause for concern.
What we do as a dietitian is to help them make an informed decision concerning their diet. We are not going to introduce any new thing, but whatever they are eating, we try to get the information about the food and modify it to suit their condition.
The management is not very easy, but the dietitian helps the child or the young adult go through the various stages of managing his diet to ensure that he has adequate growth. You know, the child is still growing, so if the food is not enough, the tendency for people to cut down on the food that people are taking when they are diabetic is very high. So for the child, the dietitian will ensure that he's getting adequate food intake that will ensure his optimum growth. So the food is not just supposed to be adequate, it's also supposed to be nutritionally adequate or balanced. Number 2 is to make allowance for physical activity, because the young person is very active, is moving around and is playing. So if he's not taking enough food, there's the likelihood of getting lower than what he needs, and that has implications in the sugars dropping too low for hypoglycemia to happen, especially for the ones taking insulin, because most type 1 diabetics will be injecting insulin. So if you are not making allowance for physical activity, they tend to get hypoglycemia. So the dietitian will help you so that you get enough food to make allowance for your physical activity. Number 3, also because the young child must enjoy life. So the dietitian is there to make life pleasurable a bit for the type 1 diabetic or the person living with type 1 diabetes. So the usual restrictions, extreme restrictions that are seen, you can exchange some candy, some ice cream, some meat pie, some cake occasionally to come into the meals. The next one is about the control of sugar. The dietitian plays a major role in helping the sugars of the child to be controlled.
Nutrition plays an important role in type 1 diabetes management, because when you have type 1 diabetes, it means that the insulin that's supposed to take the sugar from your blood into the muscles is gone. You don't have insulin at all. So you are being given insulin injection. So once you have the insulin injection, you need also to get the right type of food in order to have a balance.
The food is what turns to the sugar. So knowing how much to eat, when to eat, and how to even eat it will depend or will determine how much the sugar is controlled.
Diet forms the cornerstone of management of diabetes, whether it is type 1 or type 2 diabetes. But the most important thing is that in dietary management of diabetes, we have certain goals that we want to attain. So we want to help the individual to achieve and maintain a normal blood or near normal blood glucose level, and also to enhance, that is the way that they eat. You help them to make a very good selection of the food. We don't even take anything out of it. We modify it to suit the condition, and also to help them to, when they are able to achieve the normal glucose levels, then it will help them to delay or prevent the onset of complications associated with the diabetes.
So there are no avoidables really. We don't exempt a child from taking particular foods. We would not encourage the intake of certain foods very often and in large quantities. So sugar is one, refined sugar. We don't encourage too much intake of that one. Sometimes we allow it, but we exchange for calories so that the person is not doing it overboard. Too much refined foods may not also be very helpful for the child with type 1 diabetes. So when you take a refined food, then you must add some vegetables or something that has a high fiber to complement, because that slows down the rate at which the food turns into sugar in the blood of the child. So we can add vegetables or things that have high fiber to make the refined foods a little unrefined. Also, we don't encourage too much intake of soft drinks. It's an occasional thing, and then we exchange as well. We count it as part of the calories that the person is taking, and then we exchange. So that's soda or soft drinks. Pastries are another. Like I said, we don't exclude, we control and we manage and we add up to what the person is taking. And then another one that I would also say is excessively fried foods. But that's tricky because the child needs the calories to grow, needs to gain weight, increase in height and all those things. So We don't want too many fried foods. We will include the fried foods, but we don't want to overdo it. So the high glycemic index foods, the foods that tend to sugar a little quickly, we don't encourage the intake of too much of it. If you will include them in the diet, then you must add an unrefined sauce. That is, for example, the salads, the whole grains, and the cereals. So your morikoko with entete is there, your oats is there, your Tom Brown is there, your wheat porridge is there. Very, very nice. You know, when you give awusa koko, then the bread must have fiber in it. So it's a whole wheat bread, is advised. Or you put salad in the tea bread that you are giving to the child, so that you will introduce the fiber into the meal, so that you control it. So I will want people to take away the notion of make the way eat this, don't eat that. You know, it's old, and it doesn't make for the pleasurable eating of the type 1 diabetic. It's a young child, you know. So a child says that if you take away my spaghetti and my candy, what is living all about for the child? So you must manage it, add it into the whole thing, and then make sure that you are getting the content. That is why a dietitian is very important.
Carbohydrate counting is a strategy that you use to count how much carbohydrate you are eating, and then comparing to how much insulin that the individual is also being given. We have two types of the counting. We have basic counting and advanced counting. When you come to the basic counting, then we have the fruits. When you have 9-inch banana, then it gives you 30 grams of carbohydrates. But so this one is about 4.5 inches of banana. So this one gives us 15 grams of carbohydrate. This apple is a little on the bigger side, but the small apple, we call the medium apple size, will give us 15 grams of carbohydrate. Medium orange size give us 15 grams of carbohydrate. So when we know that a serving of the fruit gives 15 grams of carbohydrates, then when we come to the vegetables, if it is fresh vegetables, when you put the fresh vegetables into 1 cup, it gives us only 5. It's only when you exceed 3 cups that you make it 15 grams of carbohydrate. So that is why we encourage people to eat more of the vegetables. 1 slice of this bread gives us 15 grams of carbohydrate. And when you come to rice, 1/3 cup, this is the rice. When you take 1/3 cup, it's not going to be heaped, it should be level. So 1/3 cup is going to give us the 15 grams of carbohydrate. Then we come to oats. Everybody takes oats. You know, the oat has fiber. So half of cooked oats is 15 grams of carbohydrate. So for instance, if the person is supposed to take 45 grams of carbohydrate in the morning, and this one is given as 15, then you can add another one to give us 30 grams of carbohydrate. So this is what the person can take, 30 grams. Then if you want to add, maybe because they are not adding sugar, they want to add maybe a banana, cut 1 banana into it. Then this is the banana. You cut 1 and they make it 45 grams of carbohydrate. So this is what basically 45 grams of carbohydrate for a breakfast of oats and banana. This is how you are going to get it. So you don't have to eat too much. But another thing is that sometimes, somebody will tell you that, madam, I ate small kenkey, about egg-size kenkey, and a lot of beans. It's because I know beans is protein. Please, beans is also part of the carbohydrate groups. Even though it contains protein, we will count the protein differently. So, half cup of cooked beans, this one. This is the cooked beans. So, if the cooked beans is half cup, this is half cup of cooked beans. So half cup of cooked beans also gives us 15 grams of carbohydrate. So when you are eating and you are adding beans, you have to also count the beans that you are eating. So for instance, if you are eating rice and you are eating beans together, then you know that rice and beans are all carbohydrate groups. So if you are supposed to take 45, then you take half cup of beans, 15 grams. Here will be your beans, 15 grams. Then if it is the rice, you need 1/3 cup of rice is 15 grams. It's not half cup of rice. So the counting, you need somebody with the numeracy skills, somebody who can be able to read and write to be able to understand how this carbohydrate counting is done. So this is a serving of rice. This is the 15 grams of carbohydrate. So let me put it down and you see, it's not much. And then if you are eating another, so this is another 7. This is another 15 grams. So this one will give you 30 grams of carbohydrate. And then when you add the beans, then so this one is 45 grams of carbohydrates. So when you are using the counting, it helps you to be accurate. You know that how much you are eating. And another thing is that for people with type 1 diabetes, because they are being given insulin all the time, sometimes they give insulin before food, give insulin about 3 times a day. So when you are having 3 times a day insulin, you benefit from carbohydrate counting a lot. You need to know how much insulin you are taking and how much of the carbohydrate you are also using. But when you have twice insulin a day, then the carbohydrate should be consistent. Consistent means that if you consume maybe 20 grams, I'm just giving an example in the morning, there should be 20 grams in the afternoon and 20 grams in the evening. It should be consistent. And before you can do all these things, you need also to do sugar monitoring. What we advise patients to do, this is very, 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 very important for every type 1 diabetic to have a glucometer to monitor the sugar every single day. Because if you don't do that, you may even run into hypoglycemia, which is not good. So we want you to monitor before and after, before and after. And when you do before and after, you know the impact of the food on the blood sugar level. And when you know the impact, then you'll be able to make adjustment to suit your needs.
The healthy guidelines that type 1 diabetics should follow, there are in 2 ways. There's a healthy eating guideline and there's a healthy lifestyle guidelines. So with regards to the healthy eating, over frying of foods may not be helpful, too much of it, and then too much refined foods may not be helpful. Under eating is also bad. Overeating is bad. Adequate eating is okay. So make sure that you're having all the food groups, from your carbohydrates, from your proteins, from your fats and oils, from your minerals, your vitamins, your cereals, your legumes, your whole grains, your nuts, your seeds. These are the cornerstones of good nutrition. And these things must be present in its balanced form in the diet of the meal. Also, when it comes to healthy lifestyle, physical activity is important. Adequate sleep, because your sleep in itself can have a toll on your sugar control. Adequate sleep is important, especially for the child. Don't let the child stay up at 12:1 watching TV or cartoons or playing games and wake up at 5 and go to school. If it doesn't sleep well, it will affect the sugar control. Another thing that the type 1 diabetic should be doing is to be doing routine checks. True investment must go into the management of the child, because life is very important and no amount of money can equate better health.
They should also adhere to their insulin regime and follow it strictly. I want to advise parents and then caregivers and even matrons of institutions where we find these kids that the key to improve glycemic control and sugar control is adherence. They have to adhere to individualized diets plan or meal.
Caregivers, matrons, don't make the children feel so different when you are giving them their meals. You know, you hear something like a special diet for the child. I mean, it's good to be considerate about what you are giving to the child, but I have a challenge with the special dieting because it makes the children feel odd and awkward. So try inclusivity, include them in the general meal plan, but let them understand that because of this and this and this, you are superhuman being. You need to be careful about the choices that you are taking. And then let not the parents or the patrons be too restrictive. Hey, don't you know you are diabetic? You're not supposed to eat sugar. You don't have to take ice cream. You don't have to take egg. You know, don't make the child feel so sad. It's a child, for goodness sake. So let's tone down on the amount of restrictions that people will have a long list of foods. Man, you know, and I think that it works on the mindset, on the psyche of the children, and they sometimes give up. So the least that the patrons and the caregivers can do is to provide a cushioning support. Be comforting. If the sugars are not well controlled today, tomorrow they will be well controlled. Be encouraging rather than punitive and talking down a type 1 diabetic child, because you will scar the mind and the heart of the child, and it will not make the child develop very well. It's a very passionate thing for me, and I think that we need the right counseling. Psychologists must be involved in the management of a type 1 diabetic, and the matrons and the caregivers must be schooled to know how to psychologically handle the diet and the lifestyle of the child.
As a clinical psychologist, we offer psychosocial assessments for both the individual and where there is a need to the family too, for managing people with diabetes. Sometimes there are family issues, lack of family support, stigmatization, which affect their adherence to the dietary regimen, to their medication, so then it makes their quality of life very poor. So provide assessments and then interventions to both individuals and then to their family as well. Some psychological or psychosocial issues associated with type 1 diabetes is fear of self-injection, needle phobia, absences from school, especially with kids, and for some adult, absences from work. So then we have people who are having work challenges where they have to ask for permission all the time, and then where there is a longer stay in the hospital, for some people they fear that they may lose their job also. And also with the family, so we've seen cases where family, maybe the mother has diabetes, then one of the child has diabetes. So they find it difficult to even relate with their other siblings who may not have diabetes. And then there have been cases here where some siblings have feared that they may get diabetes because one of them had diabetes. Stress, anxiety, and then eating disorders are common with people with diabetes. And it affects their diabetes management in various forms. Some of them include not having a regular glycemic control because of the stresses in their lives. Stress affects our body makeup. So with those stresses, controlling their blood sugar levels become a little bit difficult because they had to manage those stresses also. Another thing is when it comes to binge eating, which is an eating disorder, it affects people with diabetes because they are conscious of their weight. So I would want to eat slowly, eat once, vomit, and then that will affect or fluctuate their weight gain. Also with eating disorders, when people make comments about their weight, how they look, how their shape is, it makes them at risk of having diabetes, either type 1 or type 2, depending on how the situation presents itself. And having to manage, for example, someone with type 1 diabetes, having to inject yourself daily, to some people it's like a relentless job, 24 hours, 7 job. So then that becomes very traumatic. So whilst the stress is adding up to it, it could be work stress, it could be family stress, all these factors affect the management of diabetes, and especially compliance. People with type 1 diabetes can live normal life. It needs multidisciplinary approach, so and regular assessment. Remember that support should be timely and should be ongoing. So when we diagnosed with diabetes and then we assist you today and we give you regimens, dietary or medication, that is not the end. You will need regular checkup. You will need regular follow-up from your health professionals and also from yourself, because it demands some form of self-regulation. It demands some responsibility from you, the individual. That is my health. I would have to take responsibility for it. And then you attend clinics. There are self-support groups for managing diabetes. to all. So if you come to the hospital and you know of one, you can request or ask your health professional, what way can I do with it? If you're having a diet problem too, you can ask to see the dietitian to be assisted. Psychologists, when you're having any problem with your family too, we can also offer family interventions. Some families could be that there's poor communication about the condition, and everyone may have their own misconception or myth about diabetes. So you could hear comments that could affect the individual. How do we help the person to manage those sense of guilt, those blame? All these resources are available for the individual. Type 1 diabetes have had negative effects on many people, and especially stigma of the individual and then the family. So we've seen cases where, for example, if it's an emerged family or they live in a compound house, because of stigmatization, such cases are not disclosed of one's condition or status of having diabetes. So parents try to shield their children, even adult children, from anyone knowing about their diabetic condition. For some people, it's difficult for them to maintain their relationships and friendships. So we've seen cases where they cannot disclose. Some, when they cannot control it or can no longer deal with the stigma, it affects their adherence to the medications and dietary regimens. It affects their traveling, because you would have to get an insulin injection pack and then be ready to travel. So in cases where you don't have a room to maybe self-inject, it becomes very difficult for them, because they wouldn't want to stay in the public and then inject themselves, because people will be wondering, what are you injecting? So these are some of the ways in which stigma is affecting people with type 1 diabetes. Psychologists with diabetes expertise, you can find some at the primary health facilities, like the polyclinic. So these are clinical psychologists who are trained in managing people who come to the hospital to seek health care in primary health facilities.
The physical exercises do it washing, and then even with the washing, you sometimes might be washing and you go on hypo.
For me, exercising is not about doing a particular thing. Walking is like an exercise to me. Cooking is an exercise for me, because all these activities can trigger a lower blood glucose level for me.
The physiotherapist is very important in the life of someone with type 1 diabetes. Physiotherapists will usually be like the expert when it comes to exercises. So we will know the appropriate type of exercises that people with type 1 diabetes can engage in. Then we will advise them appropriately. Sometimes also we have to take them through the exercise program before we release them. When someone with type 1 diabetes come and they want to procure our services, we first of all have to assess them, do a thorough assessment of them. Then the outcome of our assessment will determine the kind of physical activities or the exercises that we want to engage them in. So the kind of exercises that help to reduce the sugar level in people with type 1 diabetes are anaerobic exercises. Simple exercises like swimming. Swimming is very good. It's low-level exercises. We can do brisk walk. It's low-impact exercises. That's lower to medium type of exercises. Those kind of exercises help to reduce the sugar level, in the patient. But high-impact exercises, very high-impact exercises, like the anaerobic kind of exercises, could actually spike up the sugar level. So for example, if the person is doing a lot of weightlifting, it can help the sugar level spike up. Or when the person is engaged in a very competitive exercises. The reason why some exercises actually spike up the sugar is that we have adrenaline actually being, the hormone adrenaline being produced. So when the adrenaline hormone is produced, there is a chance that the sugar level can actually be spiked up. So we have to look at all of these factors in order to recommend the type of exercises. So for example, when you are dealing with kids, and maybe you can decide to design your exercise such that at the beginning of the exercise, you engage in maybe high impact exercises so that the sugar level will shoot up. Then after that, at the end of the exercises, you engage in low impact exercises so that the sugar levels will go down. So it all has to do with you doing a proper assessment of the patient, having a conversation with the patient, and having the history of the patient, checking on the insulin level of the patient. You really have to know the patient. Then based on that, you design your exercises. Because you don't want to let your patient engage in exercises, then suddenly their sugar level suddenly drops. Or you don't want them to engage in some exercises, then their sugar level spikes. So you have to, your advice has to be such that you actually are able to keep a fine balance to have what they call it, an optimal sugar level within the patient. Yeah. Patients are different. When you are designing exercises, you have to customize exercises to the particular patient. So for some people with type 1 diabetes, they might be able to do anaerobic exercises for like 30 minutes. But for some other group also, 30 minutes might be too much. There are two important things that you need before you engage in any exercises. Number one, you have to have your sugar with you, or your glucose tablets. In case your sugar levels are going down, you have to take them in order to bring it up. So the other item that you have to have your insulin shot in case you realize that your sugar level is shooting high, then you can actually be able to. So these are the two most important items that besides your water and other things that you have to carry along. For people who might have developed one complications or the other, you have to be careful with the exercises, and you have to get advice from your doctor or from your physical therapist before you can engage with exercise. But overall, generally, people with type 1 diabetes can live a normal life, can exercise normally, but they have to just know some of these details.
If somebody has type 1 diabetes, it doesn't mean that they're always going to be sick.
For the person who is very well controlled, they can lead a near normal life like any other person who doesn't have it.
But if you are not compliant with your insulin injections as you should be, it's not even for the short term. You may have short term, very acute complications. You can come in an emergency, you can go into a coma, you can get the acute complications. But for me, the more dreadful and the frustrating thing is the long-term complications.
So there's treatment. We manage type 1 diabetes.
So treatment for type 1 diabetes is insulin therapy. Insulin is a life-saving hormone. It is an essential hormone. You can't live without it. And once the body cannot produce it, you have to replace it. So treatment for type 1 diabetes is insulin therapy. Fundamentally, if you ask me, I had to pick one thing when it comes to managing type 1 diabetes, I'd pick support. It's critical because in type 1 diabetes, if you want to manage it and manage it well, you need to know what is happening to the blood sugar levels at any point in time. And sometimes that can be testing in excess of 10 times a day. You are testing your blood sugar level, what is it? And you use that information to decide what you are going to eat, how much of your medication you are going to inject. You are going to exercise, you need to know what your blood sugar level is. You are going to have sex, you need to know what your blood sugar level is. So you need a lot of support. Right from when they are children, they graduate to adulthood, they now take over their own life, they have to deal with peer pressure and all of that. So when they become adults.
If you're my client and you come to me every week, it means I'm not doing my work very well. So I have to give you the independence, the skills, but I go according to their ability. So it's very person-centered approach that I take. See the person who is involved and then manage them accordingly.
Managing diabetes is not an easy thing. God being so good, I had people that are helping me with my drugs and then the glucometers and strips.
I prefer to mention complications of diabetes starting from the head to the toe.
When the blood sugar is elevated, it makes red blood cells stick. And when they stick together, they die. So you have problems with blood flow, you have problems with damage to the nerves, damage to the small, tiny vessels at the back of your eyes, which will lead to permanent blindness, in your kidneys, which will lead to end-stage kidney failure. You can have heart attack if the big vessels in the hearts are affected. You can have a stroke if it affects the large vessels in the brain. You can have peripheral artery disease, which will result in amputations because the blood flow to the external limbs are compromised.
For the males, one of the common things is erectile dysfunction. So the man who doesn't work as well as it should. I think I should mention also that there are acute things that are common in type 1 diabetes that can send them to the hospital, okay? So we call some conditions diabetic ketoacidosis. It means that acutely their sugar has gone so high, there are some acids that are produced in the blood, and there are some bodies that we call ketone bodies, and this is an emergency. So once a diabetic type 1 sees that the blood sugars are high, usually they need to be in hospital so that we can correct these imbalances.
I receive support from family and the juvenile diabetes.
I don't have any financial support. I don't get anything. All we do is the NHIS that supports us. And even with that, you'll have to do a top-up. So when you don't have the top-up, it means you don't have any drug on you.
I receive support from Insulin for Life. Currently, they are the ones supporting myself and some other people living with diabetes. We also receive support from the Tema Juvenile Diabetes Group president.
Some of the challenges I encounter are that it gets to certain times when I have no money to purchase the insulin. So there is a pharmacy in my area. I went to explain my situation to them. So anytime I'm without money, I am given the insulin and I leave the medicine with them. So when I get money, then I pay back.
A lot of people don't know about it. So handling a child like that in public and those stuff, that is where I'm having a little problem.
I think the first misconception is that it is curable. You can live without your insulin injections.
People think it's a curse. People also think you've taken much sugar.
People believe that something from witchcraft, that kind of thing, spiritual illness.
People with diabetes cannot have children.
They think you can't work, they think you can't do anything like non-diabetics.
How can a child get diabetes? No, this one is attack from the devil.
Another misconception people come with is that I will die early because they said I can't produce insulin.
There's some support from the NHIS, but beyond that, I don't know of regular established means of support for them.
Unfortunately, there's very minimal support that we have, but there are societies available that are trying as much as possible to work to help to some extent. So we've got a Diabetes Youth Care, for example, which is an NGO that is looking at younger people living with diabetes. There's the Diabetes Endocrine Metabolic Society of Ghana. We don't give direct financial support, but we also do advocacy. We do educational programs so that we try and let people be more enlightened about the disease.
What pushes me forward in spite of my condition is I have people who look up to me because I've been a young leader before. They see me as somebody we are looking up to. So even though sometimes when the going gets tough, I have to push forward because I know that somebody is out there looking at me.
What motivates me is God. Admissions, my visions motivates me. What I want to do for people.
I had a godmother. She's a white woman. And then she had her diabetes when she was 23. She died at the age of 73. And whenever there is a problem, I run to her. She'll be like, Tess, don't mind. This is how it is. Look at me. Look at my age. I've given birth. My husband supported me. So pray that you get someone who can support you and understand you.
Being a caregiver for a child is the most difficult one, I will say. But if you decide to deal with it, well, I think you see it as a normal thing.
Even if one is not happy about this health condition, the caregivers should be happy and patient with those living with type 1 diabetes. They should rather monitor them, especially with their diet.
My advice to anybody who's been diagnosed is that the person shouldn't lose hope. The person can become whatever he or she wants to become in future.
Diabetes comes with what we know to be called diabetes-related distress. It is a treatable condition and a very real condition. So please, if you feel that you are not able to cope mentally, let your doctor know.
If you are a sports enthusiastic, see a physiotherapist. Let us educate you, let you understand what are some of the things that you could, the type of exercises that you can, the precautions that you can take. You need to have all of this information at your fingertips.
They shouldn't lose hope. Rather, they should focus on all the principles of treatment in terms of medical treatment, dietary treatment, and any other things that they are being told to do. It's only when they follow that they'll be able to get the relief that they want. They'll be able to enjoy their life.
Do not blame yourself for it. These are things that sometimes you cannot really explain what happened. Okay. So what you can do is, how do I move on? How do I get the best out of my life? How do I live an optimal life to the best? How do I have a good quality of life? What are the things that I could do to manage myself?
My final words will be an appeal to the government or the Ministry of Health to support us. Yes, the insulin is on the National Health Insurance Scheme, but it is not enough. We don't just inject the insulins. We need to monitor our blood glucose levels to be able to inject what has been given to us. So we are pleading with them. They should come to our aid and then help us.
Our labs too is very expensive. We are pleading that if government can come to our aid.
Remember that spiritual disease, there's treatment for it. And then there are ways in which we are able to monitor you to prevent complications of diabetes. So always speak to your doctor or speak to any healthcare practitioner, and then let's see how best we can help so that your life can be as good as anybody else.
I also plead to the government that they should make clinical psychologists available to other primary health facilities in other regions so that they could help people with their emotional challenges when having chronic disease such as type 1 diabetes.
I strongly support that people living with type 1 diabetes especially cannot do it all by themselves. It is a public health condition. They need the policymakers, the Ghana Health Services, the National Health Insurance, and the Non-Communicable Disease Department. They all have to come on board and support them with these modern insulins that can give them a bit of flexibility to manage their sugars properly, and also test the sugars a bit more, discreet, because all these young people in boarding schools holding syringes and needle, and they feel intimidated. They either isolate themselves without it, but then their life also depends on the insulin, so they will miss a dose or two and they get sick and go to the hospital all the time, maybe twice in a month or something, and the headmistress are saying that. So we should please give them the right resources, and the management will be better, and we'll all be happy family.
Life is not lost when you have diabetes, especially when you have type 1 diabetes. I have seen living testimonies of people who were diagnosed with type 1 diabetes at the age of 12 years, who have grown to 45, 50, giving birth, married, giving birth, are in gainful employment and living life to the full. It is possible to live well with type 1 diabetes. So don't be scared. Don't listen to too many people. Work with your professional.